Hello everyone, I'm Dr. Shreyoshi Chatterjee and you're watching my channel, The Medical Diary of Dr. Chatterjee. And today we are diving into a topic that is becoming more and more common worldwide. It's non-alcoholic fatty liver disease or NAFLD. Non-alcoholic fatty liver disease is the most common liver disorder in the Western countries. And it's something that affects 1 in every 5 adults. And if you are obese, then this number can skyrocket to 4 in 5 people. Surprising, isn't it? But here's the catch. Not everyone who has got the non-alcoholic fatty liver disease has the serious form. In fact, most of the people have got the milder version of this disease, which is known as simple fatty liver. So what makes this non-alcoholic fatty liver disease so dangerous? And what are the risk factors that we should watch out for? Let's break it down. What is non-alcoholic fatty liver disease? Non-alcoholic fatty liver disease happens when fat builds up in your liver, even though you are not drinking alcohol. But why are we concerned about this non-alcoholic fatty liver disease? Because non-alcoholic fatty liver disease increases our chances of serious health problems like type 2 diabetes or heart attacks or strokes. Also, if you have another liver disorder, then NAFLD or non-alcoholic fatty liver disease can make this liver problem worse. So it is really important that you stay aware of how non-alcoholic fatty liver disease affects your body. And today in this video, we are going to talk about the risk factors of non-alcoholic fatty liver disease. What makes someone more likely to develop non-alcoholic fatty liver disease? Number 1. Obesity, the biggest risk factor. But it's complicated because not all the people, those who are obese, will develop non-alcoholic fatty liver disease. And also not all the people, those who have non-alcoholic fatty liver disease, are obese. Even people, those who are mildly overweight, they can also develop NAFLD. Number 2 risk factor is diabetes. Specifically, type 2 diabetes puts you at a high risk of developing NAFLD. But interestingly, type 1 diabetes is not a risk factor for non-alcoholic fatty liver. Number 3 risk factor is your age. If you are over 50 years, then your chances of developing non-alcoholic fatty liver increases. Especially men are more prone to develop non-alcoholic fatty liver. The 4th risk factor is high blood pressure. People with high blood pressure are more prone to develop non-alcoholic fatty liver. Number 5. If your blood cholesterol and triglycerides are high, then watch out. These are very closely linked to non-alcoholic fatty liver disease. Number 6. Rapid weight loss. You might think that losing weight too quickly is a very good thing. But in reality, the rapid weight loss can actually trigger non-alcoholic fatty liver due to the rapid changes in blood fats. This rapid weight loss, for example, can happen after surgery for obesity, which is known as bariatric surgery. The 7th risk factor is medications. Some medicines like methotrexate or tamoxifen can also cause non-alcoholic fatty liver. The next risk factor for developing non-alcoholic fatty liver is if you have a family history of non-alcoholic fatty liver disease or if you have a family history of obesity. If someone in your family has a history of fatty liver or if someone in your family is overweight or obese, you may also have greater chances of developing non-alcoholic fatty liver. This is because some genetic factors can influence our body fat distribution and liver health can run in families. The next risk factor is insulin resistance. Insulin resistance occurs when your body cells don't respond properly to insulin. Insulin, the main hormone that regulates our blood sugar. This insulin resistance can in turn increase our blood sugar levels and often results in fat accumulation in our liver, leading to non-alcoholic fatty liver. The next risk factor is if you have metabolic syndrome. Metabolic syndrome is a group of conditions that occurs together, increasing our risk of heart disease, stroke, and type 2 diabetes. It includes high blood pressure, high blood sugar, excess amount of fat around our waist, and abnormal amounts of blood, cholesterol, and triglyceride levels. Having metabolic syndrome makes you more prone to developing non-alcoholic fatty liver disease. The next risk factor for developing non-alcoholic fatty liver is polycystic ovarian disease. PCOD is a common hormonal disorder which is found commonly in women of reproductive age. It causes enlarged ovaries with small cysts. Polycystic ovarian syndrome often leads to insulin resistance and weight gain. These factors make women having PCOS more likely to develop non-alcoholic fatty liver disease. The next risk factor for developing non-alcoholic fatty liver is if you have chronic obstructive sleep apnea. Chronic obstructive sleep apnea is a condition where our breathing stops temporarily during sleep. This can lower the oxygen level in our blood, putting stress on our liver and contributing to fat buildup, which increases the risk of non-alcoholic fatty liver. The next risk factor for developing non-alcoholic fatty liver is if we have an underactive thyroid gland, what we call as hypothyroidism, or if we have an underactive pituitary gland, what we call as hypopituitarism. Pituitary hormone deficiencies like growth hormone deficiency can also be a risk factor of non-alcoholic fatty liver. So to sum it up, non-alcoholic fatty liver disease is something that we cannot ignore because non-alcoholic fatty liver is very common. And the risk factors includes obesity, diabetes, high cholesterol, high triglycerides, your age, your genetics, some kinds of hormonal deficiencies. And also many of us can have non-alcoholic fatty liver without even knowing. But the good news is that with certain lifestyle changes and with certain medications, we can always reduce the chances of having non-alcoholic fatty liver and also reduce the chances of its complications. So that's all for today. If you found this video helpful, don't forget to give it a thumbs up and subscribe to my channel, The Medical Diary of Dr. Chatterjee, so that you don't miss our upcoming videos. In my next video, I'll be talking about how simple lifestyle changes like making changes in our diet and our exercise routine can make a huge difference in preventing and treating non-alcoholic fatty liver. Trust me, you won't want to miss it. Stay healthy, stay fit. Thank you.